Hey everyone, it's Matt and Ken again. All right. I always say again as if like you're sitting there just watching these all the time, right? And hey, if that's what you like to do, great. We have plenty more content teed up to deliver throughout 2024. Um, but as promised, if you saw the long-term care, getting long-term care planning right video, this is 30 minutes on Medicare basics. There's like 6 or 7 different versions of this video that we're working through. So you're going to see other versions of this come out over the next couple months. But this is 30 minutes on Medicare basics. It's really just intended to be a primer, right? Like an introduction to Medicare and things you need to really seriously consider about Medicare. Again, this is educational only. We're not selling any products on this video. It is to help you make good financial decisions. Again, Mission Financial Planners based in San Antonio, Texas. We work in 28 states. Again, hey, if you're watching us, I always pick on a different state for each one of these. So I'm going to say if you're watching us in Rhode Island today, which I hope you are, right? I hope everyone in Providence is watching this video. And you're like, wow, I like these guys, which of course you do, right? But wow, I like these guys. I want to work with these guys, but it says they don't work in Rhode Island. Call us, email us. We're happy to work in Rhode Island. We just need to get essentially licensed in the state, which is a very easy process to do. Okay, one last thing before we really get into the topic here, just a couple quick things. Remember, we are here to work with you. We are here to help you, right? And we are, as a team of certified financial planner practitioners, fiduciaries, right? Which means not only do we have to act in your best interest, we also have to recognize when something's a little out of the scope of our expertise, right? So we have a lot of partnerships we work with. One of the groups that we work with a lot that you won't see on this chart, but it's a group called Savers Health out of North Carolina. They are our Medicare specialists that we refer people with Medicare and health insurance questions in general to. So if you want a warm introduction to them, let us know. You can get a hold of us. You can email us at admin@mfplanners.com. That's ADMIN at MF, which stands for Mission Financial, not what you're probably thinking it stands for. Admin at mfplanners with an S on the end.com. You can always call us at 888-339-0093. Once again, 888-339-0093. We'd be happy to give you a warm introduction to them. If you've watched our videos before, you've seen this slide or a version of this slide. Again, we are certified financial planner practitioners, which means, of course, we follow a process. This comes straight from the CFP board. That process is real similar to probably processes you followed in your career, right? We have to get to understand the personal and financial circumstances. What are the goals? Analyze what you've done, put together some ideas and show them to you. If you decide you want to work with us and say, yeah, I want to implement this idea, hey, great, we move forward. And then monitoring is probably the most important thing, especially when it comes to healthcare. So people might be saying, well, Matt, you're saying that you guys don't actually do the health insurance. You don't actually do the Medicare. Why are you talking about it? Well, the reason we're talking about it is it's part of financial planning, right? When you look at, say, retirement, yeah, your income is important in retirement. You got to know where it's coming from, right? Check out our videos on Social Security, on long-term care, on tax planning, on estate planning, all that stuff. When you start thinking about that stuff, you have to have an income plan. You have to have a tax management plan. You have to have a healthcare plan. And then you also have to have an estate plan, not to mention an investment strategy. You put those 5 things together, I'll tell you what, most people are going to just specialize in one of those 5. As certified financial planners, we work in those 5. And that's a huge difference between us and most of our peers. And that's kind of a primer to this chart, which you've seen before, this radial. When you think about your cash flow and your income in retirement, it's going to be affected by, hey, what is the source, right? Is it Social Security, a pension, rental income, withdrawals from your portfolio, right? How does your investment management strategy need to change as you get to retirement? What's your healthcare strategy, right? A good healthcare strategy, guys, is going to have Medicare, a supplement, and some kind of long-term care plan put in place at a minimum. You'll have heard me say this on other videos. I'll say it again. If you have a life insurance policy, I should say, that you want to carry into retirement or are thinking about dropping or carrying, my recommendation is always to keep it, because you don't know what's going to happen. And a lot of people don't know what are some of the living benefits that come with their life insurance. There could be a critical illness rider built into it. There could be a terminal illness benefit of some kind. You may have a chronic care rider of some kind. So you want to make sure you have a very good understanding of that before you do anything like cancel it. And then from a tax and estate planning standpoint, one of the things that also separates us from most other people is we don't look at the absolute return of your investment portfolio. What we're looking at is your real return. So, for example, it doesn't do you any good to get 12% in your portfolio, but then you give up 48% to state and federal taxes, because 48% of 12 is basically 6%. Yeah, you got 12, you gave the government 6, that left you with 6. Put in a good tax strategy and also a good healthcare strategy to help protect your assets at a minimum. Well, now all of a sudden, maybe you're keeping 9 or 10 of that 12. Where would you rather be? With the guys who helped you keep, the 9 or 10, or the guys who helped you keep 6? It's up to you. What part of 6 do you like is the question I guess I would ask. And then from an estate planning standpoint, we have a terrific relationship with Integrated Trust Systems. They're based in Nevada. They use Nevada probate law. There's a lot of advantages to Nevada probate law. Check out our video, the last estate plan you'll ever need. That does a really good job of giving you an introduction to that. Okay, so what is Medicare? Let's just jump into it. Medicare, it's a national health insurance program for people age 65 and older, Centers for Medicare and Medicaid Services. But what's weird about it, are the people who administer it. But what's weird about it is the Social Security Administration is how you sign up. Interesting point. One of the most common ages people sign up for Social Security is 65. Part of that is because when you call to sign up for Medicare, if you're waiting, that nice person on the other end of the line will say, okay, great, you're 65, do you want to take your Social Security? We can just deduct it from your Social Security check. And a lot of people end up saying yes, right? So if you're doing financial planning, if you're doing the income plan, the tax plan, and all those things, maybe 65 is a good age for you for Social Security, but maybe it isn't, because you might be giving up some pretty strong tax advantages that come with Social Security. Who's eligible for Medicare? I'll say this: you have to be a U.S. citizen or a legal resident. I get these spam emails all the time. I want to make sure illegal aliens don't get their Medicare. We got to vote against that. Well, they can't get it now anyways. It's U.S. citizen or a legal resident who's lived in the U.S. continuously for at least 5 years, and you have to be 65 or older. Some people under 65 will qualify, but that's because they're on Social Security disability at 100%. And folks, Social Security disability is the most conservative definition of disability that's out there. The issue you're going to face there is you've got bigger problems if you're qualifying for Medicare under 65. Okay, so how do I sign up? You've probably heard of Medicare Advantage plans. There's also Original Medicare. The way I look at this is on the left side of this screen, that's for the do-it-yourselfer, right? I'm going to call and sign up for my Part A. I'm going to go find a good Part B, or A and B, excuse me. I'm going to find my own Part D, and I'm going to find my own supplement. Those are the 4 pieces that are covered on the left there. Well, Medicare Advantage plan, you're most likely going to work with an insurance agent, and we would strongly recommend you work with Savers Health, which is our partner on this. But what we would recommend is, or what we recommend with them at any rate, is use their independent agents. Those independent agents, they have to know what's out there for you. They can have a conversation with you to say, okay, yeah, here's your Part A, here's your Part B, but here's the right Medicare supplement for you, right? Here's the right prescription drug plan for you. And they're doing it based on what you tell them, what your concerns are and things like that. So the way you look at things, if you're a do-it-yourselfer, Original Medicare is the way to go. Call Center for Medicaid Services, get signed up for your Part A, your Part B, go find a Part D, go find a supplement. If you're someone who likes to work with people who, they bring expertise, right, to your problems, go with a Medicare Advantage plan. And we'd be happy to introduce you to Savers Health. All right, let's talk about enrollment. Basic principle is, unless you're covered by an employer plan with 20 or more employees, you need to sign up at 65. And in our longer presentations you're going to see coming out in the next couple months here, we'll get into some of the penalties and so on. Just know if you miss your sign-up window with Medicare, you're going to have a 10% penalty annually for the rest of your life. Okay, couple other issues. You may end up with a gap in coverage. You might not have coverage for a few months because you have to wait for one of the special enrollment windows. And if you're waiting and you're trying to get health insurance, some of your private options might be limited, might be hard to qualify, might be too expensive. Okay. So the way you sign up, if you're getting Social Security at 65, Medicare Part A and B are automatic. You can always decline Part B if you choose to. That's your doctor visits. That'll run you about $150 a month in 2023. Coverage starts the first of the month you turn 65. And then Parts C and D, those aren't automatic. You've got to choose a private insurer and then proactively enroll. Okay, so that's your Medicare Advantage. That's your prescription drug coverage. If you're not signing up, there's the initial, the special, and the general enrollment periods. Now, just a real quick primer on these. The initial enrollment period is basically you're turning 65, you're not covered by a plan at work, right? You're going to go ahead and sign up for Part A and Part B. Now, a lot of pension plans, a lot of retirement healthcare plans that you may have, whether you're public sector, private sector, a lot of those are going to ask you to sign up for Part A anyways, and and maybe even Part B. And the reason why is Medicare is always the first payer on a healthcare bill, and it helps keep their costs down. Okay, so don't be surprised if you're asked to sign up for at least Part A, maybe even Part B as well. Okay, so again, people who sign up at 65, they're not working, maybe they're self-employed, small company. COBRA, by the way, is a way that you can extend your healthcare benefits from work for a period of time after you retire. We have some people who say, you know, I'm going to retire at say 64 and I'm going to use COBRA to get me to 65. You can totally do that. We help people with that all the time. I mentioned you're already getting some retiree health benefits, and you might be working at a large plan, but their insurance isn't very good. And you turn 65, go ahead and sign up. There's nothing to stop you from signing up. Okay. Signing up for Part D, that's the prescription drug coverage. Same principle applies. Get signed up. Essentially for the same reason. Maybe you don't have good coverage. Maybe your plan wants you to sign up for it at 65. Maybe there's a medication you need and you can get it through your Part D a lot cheaper than what you're getting it today, right? Those are all considerations in terms of that Part D. Okay, so that's the initial enrollment period. Let's talk about the special enrollment period, okay? This is for people like my dad. My dad worked till he was in his late 70s, then he retired. Well, guess what? What you want to do, and I always recommend do it 90 days before you're going to retire, but what you want to do is you want to call the center, call Social Security, get signed up for your Medicare, so you don't have a gap in coverage, right? So it's the end of the year. We're recording this on December 21st. Maybe you're retiring on February 1st, okay? So you're going to get your bonus in January and then retire. So what I would do is I'd actually call them today and say, hey, I'm retiring on February 1st. I want to get my Medicare starting on February 1st. That's all you got to do, okay? Now, let's say you miss for some reason. Okay, if you miss it for some reason, they'll give you 8 months from the time your coverage ends to get signed up for Part B. They give you 63 days to get signed up for Part D. So they've got windows where you can get signed up for this stuff. However, right, you got to make sure that you pay attention to them. Don't ask me why it's 8 months versus 63 days. I really don't know. And I don't care to know. It just seems odd. It just seems odd to me. Okay, but let's say you blew it. Oh, I'm 66 now. Oh, I retired last year, right? And it's like, well, it's over 8 months ago. What do I do now? Well, they have a special enrollment period every year, which is called the general enrollment period. It runs in the first quarter of the year, and your coverage will start the month after you enroll. Okay, this is way looser than it used to be. You used to have to wait till July 1 after signing up in the first quarter of the year, but now it's the month after you enroll. So the way I always look at this is, kind of worst case scenario. So I'm a May baby. Let's say I forgot to sign up. I got to wait till January to sign up, which means 7 months went by where I maybe didn't have coverage. I'm paying, way more than I should be because I'm paying out of pocket for a private plan, whatever, right? So you want to pay attention to those enrollment dates, right? So like I said, if you're turning 65 and you're going to sign up, do it before you turn 65. If you're going to retire and you're past 65 when you retire and you've got to get signed up, do it before you retire, right? If you miss those periods of time, January 2nd, get signed up because then February 1st, you'll have your coverage. Okay, but just don't miss the coverage windows. And for this too, with this general enrollment period, not only do you have that period where you're not covered, you're trying to get health insurance, which might be pretty expensive. On top of that, now you have the 10% additional penalties you're going to pay for the rest of your life. So again, initial, sign up before you turn 65. Special, sign up before you retire. General, oops, I missed it. Sign up January 2nd. Your coverage will start in February. The way you sign up, ssa.gov or give them a call. Either way works. Same thing for, well, not the same thing for Part D. You can get a Part D program through Medicare. I would recommend on Part D, shop it through a private insurer. Again, Savers Health is a great resource for you. You're going to want to make sure that, let us know if you'd like to talk to them, because we can certainly refer you over to them. Okay, that's a lot in 15 minutes. I was just kind of throwing it at you there. Ken's going to slow us down a little bit in a good way and talk a little bit about some taxes, right? And maybe not taxes, but just fees and taxes, right? So I don't know if those are always good or not. So
yeah, let's switch from medical costs and dealing with the federal government and signing up, which is always smooth, to talk about taxes. Okay. So thank you, Matt. One important thing to really understand is your Medicare cost and your medical costs are not set in stone. Your Medicare premium is going to change depending on the income that you had 2 years ago. There's a 2-year look back, and what they look at is what's known as a modified adjusted gross income. Some of you are probably tax savvy and aware with what your adjusted gross income is. It's all the income you have minus whatever above the line deductions, and then now you have your adjusted gross income. Okay. Well, the modified adjusted gross income has a different equation, and it adds in some expenses like rental income and other, as well as municipal bond income, and it gives a different weighting to your Social Security income that's coming in. But nevertheless, that dollar amount is what's going to determine what your Medicare premium is going to be 2 years from now. So if you can take a look at the left side of the screen, you see the modified adjusted gross income for the single as well as the joint. Now, again, for our tax aficionados, you might be familiar that your federal income tax is a progressive tax, that your first dollars are taxed at a lower rate. And then as you start making more money, it's the next dollars that are taxed at a higher rate. Not with Medicare. It's what we would call a cliff tax. If you go $1 over, you're now paying this amount of premium for that year. So if we look, there we go. So if we look at the second column, if as a household you're making $194,000 and between 246, well, per person you'll be paying $283. Now, if you make $246 and $1, let me undo that. You're now paying $401 per person per month for the entire year. So that's what, an extra $120 a month per person, so $240. So an extra $3,000 of Medicare premium because you were $1 over. And it can get pretty frustrating for a household, especially because it doesn't impact you next year or this year. It's 2 years after the fact. So knowing when you're taking liquidations for a vacation or you need to remodel something on your house, knowing where that money's coming from and the taxable implications of that could easily throw you into that next bracket and cause unnecessary expenses and taxes in the future. Now, where this really impacts households, especially for those of you that are married, is when one of you pass away, because most single individuals in their later years were married at one point. Now, this is impacting one of our households. Is they were married, they were right around $300,000 of total income. So as a household, they were in this bracket, paying this amount. But now that one of the individuals passed away as a single individual, they're now going to be in this bracket. So they went from paying $400 a month per household to now paying over $630 per month for that individual. Again, just by understanding this and doing some planning today, minimizing your modified adjusted gross income for your future can save you tens of thousands tens of thousands of dollars. There we go. Now, when you're maybe utilizing your long-term care or you're having major medical expenses, you're going to have a tax form, a 1099 LTC. Now, those deductions are really beneficial to help reduce your taxable income and might have positive impacts on your modified adjusted gross income as well as your adjusted gross income. So know that the tax advantages of your income sources are a big part of your overall plan and things that we help navigate on a daily basis with our households. Matt, anything you'd like to add?
Ken, I know one of the things we talk about a lot is making sure you've got a flexible plan. And the one thing I'd recommend is, hey, check out our video on how tax planning changes through 4 stages of retirement. There's about a 3 to 5 minute segment in there that talks about a case study where someone had done some of the things Ken's talking about. And now when they pass away, the kids are going to get a bunch of money tax free, right? Because the person took advantage of the deductions they got and use that to offset income that they used to pay for some healthcare expenses. And then they had some insurance that they otherwise didn't have to use. So check out that video. It does a great job of highlighting what Ken's talking about here.
Great. Thank you, Matt.
All right. Thanks. All right, everyone, here we go. Second half of the show. All right, Medicare and private insurance. Let's talk about that. So some of the things you're going to pay, right? You're going to pay for your Part B premium. You're going to pay for your prescription drug, which is your Part D, and then you're going to pay for your I always call it a Medicare supplement. You'll hear it referred to as a Medicare or Medigap policy as well. You might decide to go get the Medicare Advantage plan that bundles all that together. Now, there are deductibles. There are portions of the doctor bill that is not covered by Medicare. There's also services not covered by Medicare, which Ken's going to talk about in his next session. But when you look at your premiums, okay, your Part A, if you have your 40 quarters with Social Security, doesn't cost you anything, okay, out of pocket. Your Part B, $164.90 a month. I know earlier I said it's about $150. That's me rounding down, but $164.90 a month in 2023. And then for your Part D, it's going to depend on the plan you get. Nationwide average on a Part D program is going to be about $40 a month per person. So if you're a married couple, you're going to have about $330 a month for your Medicare, plus another $80 a month for your private or for your Part D. But notice it says plus income related adjustment if applicable. So this builds on what Ken was talking about, right? That cliff that he mentioned, right? And we've got a case study we use in a different presentation where someone was right at $306,000. Actually, it's the tax presentation I talked about earlier, but $306,000. They go over by $1. Now, what happens is just because they went over by $1 as a cliff, they go from 164.90 plus 164.80 because that's the bracket they're in to 164.90 plus 263.70. So it went up about $200 a month for a married couple. Their Part D goes up by about $20 per person, so another $40 there per person. They're now paying $519. They were paying $401. And again, the real kicker on this is that you don't see that change for 2 years, right? So it takes time. It takes time. There are deductibles as well. Now, I always encourage people, don't worry about the deductibles. Go through the Medicare supplement or Medigap plans that are out there, because a lot of those plans will help with deductibles and the co-insurance. Okay. You don't have to worry necessarily about absorbing the cost on these, provided you're doing some kind of supplement to go with your Medicare. Okay. There's also co-insurance on prescription drug. You may have heard of the donut hole, but the last few years that has tightened up considerably. Essentially, once you get to certain thresholds, you start paying generic costs for just about all of your prescription drugs. So that kind of builds on what Ken talked about in his first breakout session. His second session now is going to get into the part that, if this stuff isn't complex already, this is the part that really, I think, frustrates people more than anything. So what does Medicare cover, Ken, and what doesn't it cover?
So an amazing piece that the government does come out with, it's called Medicare and You, and they already have the 2024 document available on their website. You should download it every year, skim it through, and it covers just about everything that we're discussing right now in their own legalese kind of way. Now, what Medicare does cover, and this is probably the simplest explanation, Medicare covers acute illness. And acute illness means something that you're sick and you're going to get better. And so it covers your hospital, the first 60 days. It's going to cover a lot of your medical services, so regular doctor checkups and everything in between, but also preventative services, things like vaccinations as well. Now, while this document is fantastic, it takes 55 pages to get to one of the more important parts, and that's what Medicare does not cover. So as we talked about in our long-term care workshop that's available for your viewing, Medicare does not cover long-term care. It does not cover dental, doesn't cover vision, doesn't cover hearing. Now, I was a musician earlier part of my life. I have a tinnitus. I used to have braces. Actually, I had them twice, so I have a permanent retainer. My eyes, due to looking at screens for the last 15 years, aren't as sharp as they used to. And I imagine most of you that are watching this have a similar story or situation. Now, the things I just mentioned, hearing aids, as I'll probably need them later in life, those aren't covered. So what are you going to do? Vision. Most of you might have cheaters, but maybe you're needing some other kind of help or assistance. And then dental care. In today's Medicare world, none of those are covered. So what is your plan to cover those expenses? Because we can't be living our life not being able to hear, not having good teeth, and not being able to see what we're eating and surrounded by. So knowing the cost, again, that Medicare, depending on your IRMA bracket, depending on your modified adjusted gross income, you might be paying $600 a month for coverage that doesn't take care of some of these needs. And that's where supplemental coverage comes in, but more importantly, just budgeting it as a part of your overall plan. Matt?
I hit the wrong button. I'm back. Okay. So hopefully that's super clear, right? You know, the whole confusion around what Medicare covers, what it doesn't cover, right? What private insurance covers, what it doesn't cover. Just remember, right? You're going to want to get a Medicare supplement to help with the acute care, like what Ken was talking about. Can help with deductibles, hospital costs after 60 days, the part of the bill that maybe Medicare won't pay, right? Some of the prescription drug deductibles, right? So that private insurance, that's your Medicare supplement. You're going to definitely want to shop for that. One note on those plans, and this is where you're again going to want to talk to Savers Health. From a planning standpoint, just remember those plans are priced based on geography, right? And in some cases down to zip code. So you may live in, I'll pick on Rhode Island again, because that's where we started today. You may live in Rhode Island, you may have a sister in San Antonio, Texas, right? In our town. And you guys might be paying wildly different prices for your Medicare supplement. Nobody's getting ripped off. It's just the pricing standards are different based on where people live. Okay. So just remember, costs will vary not just by plan, not just by company, but also by location. Okay. Medicare Advantage plans, some of those are phenomenal. People love them, right? I mean, they just love them because they get to see their doctors, right? They like the network they're in, stuff like that. Okay. Just remember, benefits and some of the cost sharing might be a little different. They might be able to get you things like the vision and dental that Ken was talking about. Please remember, though, this is not going to help you with long-term care. It isn't. It's going to help you with acute care, which again, that's something that you're generally expected that you're going to recover from. Okay. Last couple things, I'd say drug plans, if you're going to just double, I guess that'd be quadruple, whatever. If you're going to really check them carefully to make sure that the formulary covers your prescriptions. Some of you are going to have prescriptions that are maybe a little more unique than others, right? Make sure they're covered. Just make sure. And again, you're going to want to work with a health insurance agent to do that. A couple last words for you. What's going to cause your budget to change? Okay, well, rising healthcare costs. I know we've all dealt with a lot of inflation over the last few years. Healthcare continues to inflate faster than the general economy does. Okay, a change in your health status, right? You're going to have that first serious illness at some point, right? Hopefully it's the last one and then you go, right? But it's going to happen eventually, right? So that when that health status changes, you're going to find yourself spending a little more on healthcare. And you're going to have to get the right coverages to help you with the dental, the vision, the hearing, the long-term care, right? That kind of stuff. Just know this, we do enough retirement income planning for people that we've read and seen studies where people tend to spend the same amount all through retirement, relative to where they started. But what happens is the utility of the money, like what they're spending it on, that's what changes. And so in the early years of retirement, it's doing a lot of fun stuff. Maybe you're wrapping up some bills from when you were working, like paying off the house, stuff like that. But in the first half of retirement, you're doing the fun stuff, taking care of stuff. The second half of retirement, though, you're probably doing more healthcare costs, right? Things like that. So, but your overall out of pocket tends to stay about the same. This goes back to something you may have seen if you checked out our long-term care video, but you're going to spend about $300,000 as a married couple in retirement on healthcare. So please make sure that that is part of a budget, whether you work with us or not. That's one of the things we do with comprehensive financial planning is not just a retirement income plan, but what are you actually going to spend the money on? And how are we going to make sure you're in a good spot, regardless of what might happen? Okay, to wrap up here, just 3 important reminders. Number 1, get signed up for Medicare on time. Remember, if you miss the enrollment windows and you have to sign up in the first quarter of the year, you're going to end up paying that 10% penalty for the rest of your life. And on top of that, you're going to probably have had to buy some coverage, which may or may not be as good as what you were going to get with Medicare, but probably more expensive. If you want to work with Savers Health, you got to let us know because we're kind of the gateway to them. So from shopping carefully with private insurance, they could be a great first step. I just need you to let us know. And again, you can always email us at admin@mfplanners.com. You can go to our website, fill out a form. You can call us on our toll-free number, which is 888-339-0093. Once again, 888-339-0093. And the final thing is plan for healthcare costs. It is part of your plan. It goes back to what I said at the very beginning of the presentation about real return. It does you no good to get 12% in a portfolio if the only amount you actually get to keep is 4, 5, 6%. It doesn't do you any good, right? Those higher healthcare costs need to be baked into that consideration to say, hey, here's what my money's really doing for me. And again, it's part of the big plan. Right, we keep coming back to that, but I just really want to pound this point home in the last moment here. Right, you've got your income from Social Security, rental, pensions, whatever it might be. You've got your cash flow coming off your investment policy or your investment strategy. Your investment strategy probably needs to change in retirement. It isn't just grow anymore. It's grow and provide income. Right, your insurance plan. Remember what I said about the life insurance policies you have. Do a careful review of those if you're really thinking about getting rid of them. Medicare and long-term care. Medicare supplement, and long-term care, those are the 3 legs of a great healthcare plan in retirement. And then tax and estate planning as well. Real return. It's all about what you keep. And from a estate planning standpoint for your family, it's also all about what you keep. So from a planning standpoint, just remember, we're talking about individual topics to help you learn this stuff and feel good about, the decisions you're making. But please remember, all those decisions need to be made in the context of a much larger plan. So given that it's almost noon Central Time on Thursday, December 21st, we are closing our office for the winter break on Friday the 22nd. We'll probably update this within the next 3 to 6 months, somewhere in there once we see some new numbers come out and so on. But again, please give us a call. You can call or text me and Ken. You can see our numbers on the screen in front of you. And yeah, that's Ken over there. I'm Matt.
Yeah.
Ken, any final words?
Guys, thank you. You made it all 35 minutes. So appreciate your time, attention, and take care.
All right. Thanks, everyone.